Hello, my name is Happy Amwa. I'm an MPH student at the Liberty University, majoring in health promotion. This video is a reflection or report of my practicum experience with the YMCA of Central Virginia. The YMCA of Central Virginia is a fitness center with about 4 different locations here in Lynchburg, and I was privileged to work with the downtown YMCA branch here in Lynchburg. The YMCA is a fitness center that provides different services to community members to be physically active. They had services ranging from yoga classes, physical therapy sessions, swimming sessions, and what have you. So during my time on the second slide, due to the COVID situation, the lockdowns and other measures that were put in place to kind of help keep the pandemic, most members didn't have access to the fitness center. And as such, it was realized that most people were not being physically active as recommended. And as per the physical activity guidelines for Americans, adults are expected to have at least 150 minutes of moderate intensity aerobic physical activity in a week. That means that members were supposed to have at least 30 minutes of physical activity over a period of 5 days a week. Now, since it was a concern that people were not having access to the fitness center, the parks, and other venues where they could be active, the wellness coordinator and myself came in agreement that we needed to find ways and means to continue to engage community members even in the comfort of their homes. The target population for this project was community members, YMCA community members between the ages of 30 to 60 years of age. Now, there were smart objectives that were set to guide the period of service at the place. And the first objective was to create and disseminate health campaign to promote wellness education among community members. And this was to be measured by dissemination of deliverables on the YMCA Live Facebook page. Now, before I go on, the YMCA of Central Virginia had a live Facebook page, and that was the agreed medium or channel for which educational materials or campaigns were going to be disseminated to community members. Now, the second SMART objective was to create and maintain an increased social media presence by fostering community attitude towards improvement in focusing on the 9 dimensions of wellness. And this was to be measured by a log of weekly social media postings on the YMCA Live Facebook page. Now, the third SMART objective was that by the end of the practicum, I will lead and implement a virtual health fair to encourage or increase physical activity levels among community members, which was to be measured by the implementation of the fair and also a report of daily physical activities using the recommended app. Now, the next slide, which is the third slide, talks about the methods and how we plan to achieve these objectives. Now, the first step was to create educational activities that covered sleep hygiene or sleep health campaign, wellness challenges, and a virtual health fair to challenge members to be physically active, as already stated. Now, the chosen medium for communication was the Facebook Live page. These educational materials were going to be in the form of video posts, regular posts, pre-recorded Zoom PowerPoints, virtual health trainers, and live exercise sessions on the Facebook page. Now, the next slide, which is the fourth slide, gives a snapshot of activities that were carried out. Now, for the first objective, which was the sleep hygiene, the shot you see or the picture you see over there talks about some of the viewers' comments and the number of views we had for the first major posting. Now, it was interesting to note that out of the 2.7K members on the Facebook page, an average of 355 members, which represents 9.57% of the population, were seen to be active, and the others were just not active on the page. So for the second objective, which was the wellness challenge, The picture you see talks about the spiritual dimension, and under each dimension there were challenges that were presented to community members. And for the spiritual dimension particularly, members were challenged to write something they were grateful for each day of the week. And throughout the week, members were challenged to think positively and also find time to meditate on their life goals and achievement. Now, the third objective, which is on the fifth slide, is talking about the virtual health fair. Now, the virtual health fair was supposed to encourage community members to be physically active, and the performance matrix or the results was going to be recorded from members signing up on the Google form, logging in their daily physical activity prior to the start of the program. And then during the program, members were encouraged to use the C25K app to track their physical activity levels or their levels of activity daily and log them onto the Google form that was provided. And to see any improvement in their levels of activity, we were going to have a data collection of the various logs that were presented, and data was going to be analyzed to see how much improvement has been achieved over the course of time of the program or after the program. And also a data analysis was going to be done using the Microsoft Excel version to analyze the data. Now, it was interesting to note that due to organizational change in time and program, the virtual health fair could not be carried out within the time that I had for my practicum experience. That being said, throughout the period of 120 hours, there were competencies that were required to be utilized during the service. And I must say that being able to work with other coaches and wellness coordinators, as well as the entire staff throughout the process of implementing the wellness activities or campaign, helped me fulfill my second foundational competency of performing effectively on interprofessional teams. Also, being able to carry out the needs assessment prior to implementing or developing the deliverables help fulfill the core competencies of the use of data to target the needs of the poor, underserved, or vulnerable population. Now, also being able to apply the principles of leadership and governance help to achieve the competency of building and maintaining organizational relationship and community collaboration throughout the period of service. Now, I'll go on to the next slide, which is the sixth slide, which talks about the limitations of this practicum experience. Now, we found out that members were less active on the YMCA page, which was the chosen medium for disseminating the deliverables. And so it was hard to engage community members to promote deep learning experience. Also, a change in program activities at the Y limited the researchers' efforts to implement most of the activities planned. Also, lack of reliable internet access could be a reason why members were less active. And so for recommendations, which is the seventh slide, we recommend that future programs should be designed to be more interactive, or better still, find other ways to engage community members to ensure that learning is taking place. Also, I recommend that presentations should be done timely to ensure that people are at the time that people have access to their phones, and also to curb engagement decline among participants. Moderators or wellness coordinators are to ensure that they post frequently on the page, ask questions to kind of engage community members more to ensure that learning is really taking place. Overall, it was a pleasant learning experience for me, and I enjoyed every bit of it. Thank you so much for watching. My name is Happy Amwa. Bye.